from Boston, grew up in the hard part of Boston, slums of Boston. And she went to, very bright, a wonderful lady, and she went to Western Reserve and knew Geiger. And they kind of kept in touch through the years. And we've seen them within the last year, and I think Geiger is still alive. He's about 90, I think, and has got some real health problems. He's got, we're off tape now. I wasn't aware of that. I mean, it could well be. Wasn't aware of that. But I had a great mentor who was my preceptor in Mount Bayou named Joanne Roberts, who was the best of what any physician can ever be. And so I had a very good experience. So coming out of that, I was interested in what the Student Health Coalition was going to do. And it became apparent that it was more than just a project that was going to give people a good, the outside interveners a good experience, that something, at least there was a possibility that something more long-lasting could be left. And that's what I think is, I think it's very well worth, going back and really looking at this to be able to celebrate what, in fact, what contribution it was made by a bunch of group of idealistic, charming and enthusiastic young people, students, and for them to, not just to celebrate, but for them to really know that there's summer efforts and things really did make a difference, because their interaction with the community here really did lay a foundation for this tiny little clinic, which in fact has grown, in 35 years, 36 years to a large organization which, serves 20,000 people in 11 medical clinics and 2 black lung clinics and maternal health outreach clinic, but serves, 20 to 25,000 people in Southwest Virginia as a community health center, so that there are many people we have that, so it's federally funded, and of course it's subsidized to make medical care available to people that otherwise wouldn't have access to the system. So there are many, many people in Southwest Virginia that do get medical care, have access to a medical care system, and generally a lot of very good providers in the system, because a foundation was built. Now, there was, there was really a combination of the health fair and then a very interested and very active community that organized around that and took it from there. And then
it would be, I think that's one of the things that we recall was such a hallmark of the Student Health Coalition, was this relationship with the community. Are there specific people you can remember meeting at the beginning, or stories about their reception of you or your perception of them that would help sort of fill out give us some detail about what it was like to get that relationship going?
Mm-hmm. Well, I think, there are many people that I remember well, because I came here a few years after I was here with the coalition. I was here as a preceptor in July '74, and then, it was 2 years later that I came as the doctor in August '76. So there was still, most of those people were around. So yes, I was involved with many of those. Many of those became my patients. But in general, I think the whole group of people from the community that participated in the health fairs were very warm, personable, very welcoming to the students, and I think the students appreciated that so much. I mean, the warmth that they were received, and I know many of those students really kept a good ongoing relationship with a lot of the people that they'd stayed with in the community. I know some that were writing letters decade after they were here, And most of the people that were in the community from that time, most of them have passed on. There's very few that are still. But I know they had very good relationships on both sides, and that's a credit to the community, and I think a credit to many of the students who developed those and nurtured and kept up those relationships.
You talked to us earlier about the couple whose picture we saw.
Yes.
Were they
Yeah.
somebody that you met early on?
Yes, it was Howard and Elsie Elliott, the picture that we talked about, and they were very active in starting this. Howard was had started in the mines when he was 14 years old, and was nicknamed Trap because he was involved in the ventilation system. I think they were called trappers, where they would be able to work in shifting the ventilation from shaft to shaft. But Trap, or Howard as we called, and Elsie were very loving people, very warm, opening, welcoming. And there's so many of the Student Health Coalition students that were in and out of that house, and they fed so many of those, or put them up and slept them. I mean, he was otherwise nicknamed as Help Yourself Howard, because as soon as you got there, he would help yourself, which meant you go in the refrigerator and get whatever you wanted. But Howard and Elsie were very involved in the health fairs and the coalition, but in starting the clinic and getting it going. And I think Howard was on the board early on and things, but there were many people like that in the community.
When you first came up here, did you stay with the family in particular?
Well, I knew Howard and Elsie very well. I think I talked to you the first time I came to St. Charles was with John Williams, who was Legal Services, and Howard drove me up here to the clinic that was probably in probably in the spring of '74, something like that, and they were having a board meeting, and so I walk in, and Elsie was the first one that introduced herself very cordially to me, and but there were many people that were involved in the in the fundraising and in the actual building of the clinic, and that was a good time.
I'm still trying to get at what it was. I think we're all struck with how we were foreigners in a strange land, and how did that bridge get built? Are there things you remember about feeling awkward or afraid when you got? You sound like you were actually quite made to feel quite comfortable from the beginning, but both of us, the community people and the students, had to have crossed a divide to get to know each other, and we're trying to kind of get at what made that so possible for us.
Well, I don't know if there's an easy answer to that. I mean, it's clear, for most people, they were coming from the outside, from a different subculture. And I think and hope that most people looked upon this as an opportunity to get to know new people and a different subculture, and that judgments could be, that it could be done in a very open and non-judgmental way. And I think, probably for the most part that probably happened a lot, or else I think those relationships wouldn't have developed between the community people and the students. I mean, there's so much to learn from, the people here, and there's so much richness to the mountains and the communities that for anybody who will open their ears and eyes and their heart, they would learn a lot.
Well, it sounds like that might be the same answer to this question I'm about to ask you, but you stayed. A lot of people came and went on and had wonderful lives as well, but you came and actually applied your trade here for
Yeah.
your career, and
Yeah.
so
Well, it was a good match for me. I was here. I was here 10 years as a single person, so that was probably the hardest. And it's hard to be anywhere single, I guess, but it's really harder in a rural area where you're pretty isolated, and you may not have a real peer group. And I was working harder in those days. The first 7 years, I didn't have a partner, and there was, you were on call almost every night, and then you were on call every other night after that as well. But but I had the good fortune to meet a woman from the mountain, from this area, who was, who was very much committed to the mountains and being here, who was a school teacher and later attorney and a community organizer and activist who really committed herself to work in the mountains. And so I think I probably wouldn't have been here I'm sure I wouldn't have been here for 35 years if I hadn't had a loving and nurturing marriage, to do that. I probably would have left or burned out or been an alcoholic or something at some point. So I think that's what made it possible to stay. Plus, I really, it really was the kind of thing that I wanted to do, in the sense that, I wanted to be in a rural area, and I wanted to be in an area of need. And, as far as I could see, my own personal philosophy is that healthcare is a right, and it's a huge moral issue that the richest country in the world doesn't have a healthcare system that people can have access to, that it can be one of the biggest causes of bankruptcy in this country, that it can be, that 50,000 people can die every year because they can't get medical care. So that's an embarrassment. National embarrassment. It's a moral issue. And for me, I was not interested in corporate or private practice medicine because no matter what your intentions were, if you're working within that system, you would, whether it was your choice or not, you'd not be able to see at least some people who, because of need, because money would always be an obstacle. So, there was only two systems to really work in, I guess maybe three. I mean, you can have nonprofit charity clinics, of which many spring up across the country to try to serve underserved, or you could work in a VA system, which in the last, I guess 35 years ago, when I was getting out of residency, except for academic centers, the VA system, we felt didn't have very good medical care there. And that's transformed a great deal now, so that I think VA systems uniformly, as near as I can tell, provide very good medical care. But that wasn't the case back then, and I didn't have a particular interest in being in the VA system. And I had a great deal of interest then in the community health centers, because people could be seen. You didn't have to, as a physician or provider, worry about anything about whether the person did or didn't have enough to pay, whether they were insured. You could just focus on taking care of them. It was a vehicle where people could have very little financial obstacles to getting access to care. So that was important to me, and that was a good match for me. And then being in the mountains, and then just as you go along, the longer you stay in a place, the richer, the more, you get more and more layers, like an onion of meaning, maybe, of, you take care of generations of some families, and that, that's just added meaning for me in terms of being a primary care doc in a little town, is knowing families. I had this wonderful lady I still take care of. She's 87, 88 now. A year or so ago, she walked down the hallway coming to the exam room, and she was on her walker, and she said, this is Mary Alice, she said, "You recognize this?" And she's a plain old walker, and I said, "No, not really." And she said, "This was Mama's." And I'd taken care of Mama about 25 years before. It was a wonderful lady, and a lot of good memories there. But so I think, and I think that a lot of docs now miss out on all that, whether they're a specialist or, that kind of richness that I think of fabric of medicine. So I have, I've taken care of a lot of people that it's 3 generations in a family, excuse me, and sometimes 4, because I'm getting to be an old guy.
Would you like a glass of water?
I think I'll get some water. I do think the project and looking back is an important one, not just for people involved to have some degree of celebration and of what has been accomplished with student health coalitions and communities working together, but also to get the message to young people today. I mean, that, this is, the students couldn't have imagined that, 40 years down the road, a lot of what a foundation they were building for what happens. And of course, thousands and thousands of people contributed to the rest of the building of that building. Community people and professionals and good docs and, all kinds of thousands and thousands of people throughout the region who kind of all built this thing like a piecework quilt, and has made something very real, very tangible, and that's helped a lot of people through the years. So here were this bunch of students who didn't realize that you can't do anything like that, and we hope that message gets on to a younger generation. I'm not in touch with a lot of college students nowadays, so I don't know. And there was a time where there was, in fact, more attention to, the whole 60s was many things, but it was an era of real attention to social justice issues and a great deal of idealism about trying to bring about social justice, whether it's in civil rights or health care or anything else. And there's not that degree of passion about it on the largest scale, although I know there are reservoirs of those people that are still there, because you run into them now and then, and that's always great and refreshing.
I'm curious, did you participate in any kind of the stereotypical 60s and 70s social justice things? Did you march? Did you boycott? Were those a part of your self coming up?
Well, you'd have to be been partly brain dead or so self-absorbed that you couldn't, if you didn't do that, So, I'd come out of a background of, my dad was a Presbyterian minister, we grew up in Elko, Nevada. My parents at all weren't in any ways material-oriented. Work was indeed service to people, and so I had that very much, I guess I was marinated in it, I guess I would say. And that kind of stream, and then the confluence of this wider world of attention to social justice and things was, was kind of all influenced on how I developed and who I was, I guess. Um, but let's see, I got lost track of.
Well, were there
Oh, so what did I do? So I was I was involved in the anti-war movement, and
Were you
because I
eligible for
thought
the
I was eligible for the draft. After a great deal of soul searching and things, I thought it was an immoral war. I thought it was misguided, and couldn't support the war in any way. And I was a conscience objector, and I was given finally conscience objector status, as even though I had the privileged opt out as being a medical student, but I was very involved in a lot of the things. Didn't spend any time in jail, but probably should have, over the issue. But in terms of fast demonstrations, dodging police with billy clubs on big horses, I was involved in that.
You were?
Yes. I was not involved in anything violent, and I didn't believe that was appropriate or right. But I was very involved in the anti-war movement.
And that was, the Billy Club incidences were around the war protests?
Yeah, just one demonstration I went to at Western Reserve, there were, it was a big campus strike, and thousands and thousands of people, and the police broke that up with, the horses in there. They're a little different to see that in the movies than it is very intimidating. These horses are, and police on horseback. But as I said, it would have. There was certainly many honorable reasons to go to jail over what was going on in the Vietnam War. But I didn't. I wasn't.
Well, you describe yourself as somebody who brought a really strong ethic of social justice and a sort of moral purpose to your career arc as a physician. But it also seems, what I know of your publications and your work, that you've brought a certain scholarship that's carried you through as well. So can you talk a little bit about the clinical, the sort of trend of, or the arc of clinical issues that you've followed here in St. Charles over the years that you've been here? Because you've clearly been engaged with them, and more than just making sure that there's primary care, you're actually very engaged in as a scholar.
Well, that's the first time I've ever been accused of being a scholar, Margaret. But what I became active in was the drug problem that we got, and I never had any interest in drug or alcohol issues. I would just as soon be the other way, walk the other way, because I had very little understanding of addiction. We had, in medical school in those days, I hope it's a little different now, but I'm afraid it probably isn't in many training institutions. You had very little exposure to addiction medicine, very little understanding of addiction medicine. You carried a lot of the same kind of prejudices and that that is prevalent in the population at large. Well, it's their fault. This is what they got into, and it's not really an understanding of addiction as disease. But anyway, what got me, that digresses. So, I started seeing in the late 1990s, 1999, 2000, there was just this huge tsunami of young people getting addicted to OxyContin. And opioid addiction, which is heroin addiction or Percocet or OxyContin, was an absolute devastating problem to have, an illness to get. And so I was starting to see, I'd have all these families come in who'd have all these children that were in high school or they were OxyContin addicted, and it was just absolutely devastating to the parents. I'd have young people themselves or grandparents coming, worried about their grandchildren, trying to get some advice or help from me, and or some of the young people themselves. And these were a lot of kids, bright kids, good families, all kinds of promise ahead of them. But they'd fallen into this thing. So I became, that is pretty compelling. And I had nothing to offer them. I didn't have any professional skills. I didn't know about addiction medicine and so on. So I became involved on my learning curve about the OxyContin problem, and tried to become knowledgeable about addiction medicine, particularly prescription opioid addiction, and tried to become knowledgeable about why this had happened. And there are many factors that were involved in why we had and at that time, in 1999-2000, the OxyContin problem was in the coal fields, Central Appalachian coal fields, and in Maine, in an area very similar to ours, poor area, an area where there was a lot of people having to do physical labor, whether it's in the logging industry or farming or other. But it was, we were just amazed when we saw this story in the Boston Globe describing this problem in this county in Maine, which was just our problem. We thought it was just our problem, and then it became apparent it was a universal, it was a wider spread problem, and soon to be, we were the canary in the coal mines about what was to become a national OxyContin problem. So what I spent some time studying, researching, trying to understand about the marketing of OxyContin, and because it was very apparent to me that at least part of the reason why we had an OxyContin problem was the manner and the way that this company, Purdue Pharma in Connecticut, had marketed this drug. And you don't have enough memory cards or enough tape or weekends for us to talk about the specifics of it. But and again, it wasn't the whole problem, but it was I think it makes an impact, but it doesn't, it hasn't transformed Virginia, it hasn't.
Well, not in a perhaps sort of, like you said, quantifiable metric kind of way. What about the political structure? I don't know that's not quite the word I meant, but the structure of the clinics is that they still remain in the control of the community at part of things, and that's such an unusual model in the rest of the United States. I don't think anybody in a big city where I come from feels like healthcare belongs to us in that way. Is that a factor that?
I think that's a real positive thing. I think as our clinic grew, as with St. Charles being maybe the first clinic out of the whole system, what later became a big system. In those early days, it was very much more close community involvement. People on the board and shared dinners at the clinic, or shared celebrations, fundraising, things like that were more rooted in the community. Now and so we had our little local community board and so on. As all of the community clinics, as the whole organization grew, and you've got all these different communities, and then you've got an overall board, I think one of the casualties of the growth has been that you've lost some of that, involvement with the community. I mean, you still have representatives from our local board going to the overall board, but you've lost some of that sense of community, some of that sense of community control and ownership, I think. Again, not that you can, that's very subjective, but observation and things. I think, and certainly in the early days, there was a real sense of where there was so much community involvement in building the clinic and things. It was a real empowering thing for people. In those days, St. Charles was, 20 years before, had been the most vital and largest town in the whole county because there were, mining was huge. There was 5,000 miners on one shift at Bonnie Blue, one of the coal camps up here. There were movie theaters in St. Charles, hotels in St. Charles. You couldn't walk through town on a Saturday night untold because there were so many people. So it was very active, but as things fell away through the years and it became kind of a burnt-out coal mining town, you know, the rest of the county, I mean, it was almost looked on, the ghetto was Lee County, you know, was St. Charles, and nothing really good is going to come out of the efforts up there to build a clinic, and who's going to come anyway, and nothing's going to happen. So I think it really was an empowering thing for people to really work hard, build a clinic, turned out to be a good clinic, which grew and expanded. And some years later, when they were trying to develop some work and other enterprise here, they were looking at trying to develop a sewing factory in St. Charles, and I think my wife was actively involved with the community group then. And somebody got up at a meeting and said, well, we built the clinic, we can build this sewing factory, you know. But that kind of sense did kind of permeate, so that it was a sense of pride and a sense of accomplishment and was a sense of empowerment. And I think a little of that's lost when you get, you know, a big organization, many counties and stuff. But nevertheless, it was important contribution.
But it sounds like from the anecdotes that you've told us that patients who use the clinic and who've known you and who knew you now for 2 or 3 generations really continue to pass along that sense of belonging to. I mean, this is their clinic. You know, it's like it's been a continuous presence and in a way a continuous source of pride for them in the community.
Well, I think it is a real source. It has been and continues to be. Yes, this clinic has never been broken into in 36 years. Which I think says something for it.
Margaret, could we go back, maybe, if you don't mind my interrupting, the things that Art was telling us about the specifics of the health fair and the sheets being hung up and all that, before, you know, just kind of relating to this time that created that pride, would this be an okay time for him to, you know, now that I've got the tape going?
Yeah, let's pause for 1 second and see, because we want to budget our time well.
Okay.
Almost 3.
So we talked a little bit about the first health fair was here in 1973. I wasn't involved in it that year, but because I just started my internship at Vanderbilt in July '73, and they had it at the school down here, which was the former high school, and like in a lot of the communities they went into, they would use the classrooms and they divide it up with these sheets, partition it with these sheets, so you'd have 6 or 8 exam rooms in a classroom, you know, and doing pelvic and PAPs and histories and exams behind these sheets. And of course it was a great experience for the students. I mean, just usually their first clinical experience. And then just a great experience about being welcomed into another part of the country and the culture. And I mean, the testimony for how important it was in the, you know, for for people in the community would be that they'd see, I don't know, 10 medical students, they'd see 120 people in a day, they'd see 1,100 people in a week, and people would brave the, mid-July 90-degree heat in the schoolroom to do all this stuff, and were patient and thankful and grateful about getting it done. And then the community organized that year and really built that structure, the middle structure of the clinic, the original structure of the clinic that I told you. And you can see some of the pictures from. And so by this summer of '74, they had a booster health fair, which I think again was July. And that year I participated as a preceptor for the students. So that was my first time at St. Charles and my first real exposure to the coalition. They had it in the building, wasn't completely done yet, no air conditioning, big fan in the hallway to try to cool it down a little bit, but in these little hot exam rooms they examine. Again, quite successful, big need, and a lot of gratitude for it. Now, Nancy Rabin and Polly McClanahan were the co-directors of the health fair that year, and they were wonderful, and they're great. They're terrific people and very bright, and were very good co-directors. And Nancy, after she graduated from Vanderbilt, and Nancy's bright enough, she could have gone anywhere and done anything, and she came up here to be the administrator for the clinic, or to try to get it going, because by then, they had the building and they didn't have any funding, and there's no association with the National Health Service Corps and everything like that. So she wanted to get it on its feet. And Nancy was here for a few years. I don't know how long. I can't remember how long. It might have been 3 years or something. But she really established she added the foundation to the clinic that made it be able to be function as a clinic, and got the funding and the association with the National Health Service Corps. And then she broke my arm multiple times trying to convince me I needed to come up here. Because it was the kind of place I wanted to be, and the kind of medicine I wanted to practice, but I wanted to do one more year after my completion of my residency where I'd have more a generalist kind of training, so I could spend a couple months on peds and a month on ENT and all that stuff, so I'd be better prepared to be a primary care doc. And as things went, and then Polly came along, and she opened the clinic. They opened in February 1976, and she was the first provider there. And they had a local doc, Sandy Rock, who was kind of the backup and was here just part-time. But Polly was there. I was finishing in June of '76, and then they kind of convinced me that the clinic might not be able to survive another year without a doc, so leaned on me to come up, so I did. So much is owed to Nancy and Polly for their role and what they've done. What else do we need to talk about there?
What else?
Works for me.
Before we shut it down totally, I wonder if it would be nice and hopefully even fun for you, Art, to say something like a message to young people, or to people who because we all feel like, oh, wouldn't it be great if we could sort of take this and inspire or encourage or help people see what a fabulous thing it's been. So if you had a message to give to medical students today or young kids today that are thinking about service.
I don't know. There's no soundbite little message other than this was a generation of students that didn't know they couldn't do something like this, and with a lot of enthusiasm and interest and passion, made a big contribution, which has affected a lot of people through the years. And I'm sure that's possible with every generation. And it may not take the guise of a health fair. It may be some other issue in your community. It may be something that there's enough needs out there. There's enough social injustice. There are enough problems in the world that if one doesn't quite match with you, you find the one that speaks to your heart, and you can figure it out. What else was I going to say? I'm going to say something else. Well, I ran into Dick Kudo at, of course you read this book, on streams of idealism in healthcare. So that's the only book that I know that have been written about the Student Health Coalition efforts. And Dick was in charge for a number of years. But my wife and I spoke on the flood of OxyContin in the coal fields at a Appalachian Studies conference, maybe 2 years ago now. And Dick was there, and we talked about it. I said, this is really important. You need to find somebody because he taught, he had a lot of students wherever he taught. I think he taught at Antioch last or something like that. But he's taught a lot of places where he'd have a lot of access to graduate students. I said, this is an important graduate student project to really go and document this, follow-up of your book, a follow-up of what's happened with Stone Mountain. And I'm not aware of all the follow-up with all the other clinics in other places, East Tennessee, that they started. But there's a lot of stories to tell, and it looks to me like a good PhD thesis or something. And he was kind of interested, but I don't know. But those are kind of, for somebody, if that strikes a chord in them, this would be a very good project, I think, to do.
I really thought
look
about
at that.
This as a sort of, speaking of scholarship, a sort of scholarship project for a young person
and, just to go to things that enormous number of things I don't know about, like the little histories of each little clinic and how it came into organization, stuff like that. But that would be a book you need to read, I guess. The streams of idealism in healthcare, and talk about the Student Health Coalition. I can't find it. I looked within the last year. It's somehow misplaced in my library, but yeah, it's a good read. So that's all I can.
I'm tempted to take just 2 seconds to show that last minute clip of Bill at the end of the tape, because it's exactly what Art just said. You know what I'm talking about? Yeah. Did sort of unbid. I guess I asked him something similar, like talk to us about what kind of message do you want to give to people, and you'll see he's you'll see. Speaks for itself.
I wouldn't necessarily encourage people to do the same thing we did. I wish it were available to them. I'm not so sure it is. It's a new world, and things are a lot different than they were. But there are other things that need to be done. Agriculture, nutrition, jobs, food, and what's on it and what's not on it. You can go on and on and on and on. But that you follow your heart. If you don't like dealing with strip mining, that's okay. Just find something. But if you are interested in strip mining, I hope you hurry up. You left the strip.
Amen, brother.
Unfortunately. think it's important for them to remember that they're the ones that did it. I mean, you and I are old timers, and we had our chance to do it the way we wanted to do it, and I think we're right by and large. I hope they'll try it too. Something. And if you don't come away with anything else, you know, I don't care whether they're Klan members or gospel church members or down at the Episcopal Church. They're all the same. For the most part. Thank you.
Well, that's pretty powerful.
Yeah.
You guys did great. Wow.
More remarkable person than I am.
Things about it. But it's added at this state, and I'm not just complete novice, I mean, we're 4 months into it. It's added an hour and a half to a previous 12-hour day for me, you know. So it's hard.
Get up next time the 50 push-ups.
Yeah,